About 15 years ago, when I was the chief economist of the Global Human Development Report, we were to write the report on the MDGs. So before I begin to say anything about the SDGs, I want to sort of tell you a little bit about the kind of challenge we faced when we were writing that report. So we went to the documents of the UN Statistical Commission, and that informed us about the following rather dismaying state of affairs about MDG related data. Please let me just remind you, the MDGs had only 8 goals, 17 targets, and about 70 or 67 odd indicators. I mean, compare that to the 230 odd for the SDGs. Anyway, what the UN Statistical Commission told us effectively was the following: that for about 2/3 of the countries of the world, at least for 1/3 of the indicators, we didn't have 2 points of time, data for 2 points of time. If you don't have data for 2 points of time, how are you going to assess what progress you made? And of course, if you have only 2 points of time over a long period of time, then that's not very useful either, because you're not being able to assess what is the progress you're making in the short run. This is the challenge which we started with. So of course the UN system made a lot of effort. It put in place a lot more demographic and health surveys across the globe. It put in the multiple indicator cluster surveys which the UN system supported. Anyway, we came to the SDGs, where we now have 17 goals and 230 individual indicators. In other words, nearly 3.5 times the number of indicators which we had for the MDGs. Now the tragedy is that when the indicators were being chosen for the SDGs, it's interesting that whether the data was available or not was not necessarily something that was a criteria when deciding an indicator for the SDGs. Now, if that's going to happen, then you are already up against a problem. I'm not saying that availability of data necessarily should drive what indicator you're going to choose to monitor. What does the international data sort of analysis, limited as it is in regard to the data, we are in the early stages of the SDGs, tell us that just 42% of the indicators are tier 1, meaning that they have an established methodology and regularly accessible data, according to the interagency group on SDGs, which is the intercountry group. And only 62% of the tier 1 indicators, in other words, only a quarter of all indicators, could be found online in a publicly accessible way. A few things about social indicators, a few things about poverty indicators, and a few things about employment-related indicators. In any country, data and the public's accessibility of data is politics. If the data is good, governments want to release it, make it available publicly, easily. If the data is not telling you a very good story, they don't want it to be released. Or even if it gets released, then there are plenty of people who might begin to trash it. Just trash the data. You begin to trash the data, well, then there's no story. There's no story for you as researchers to tell. There's no story for journalists to tell. And increasingly, and very importantly, and this is very useful, in fact, this new trend in journalism today, I notice this trend particularly, that journalists actually want to look at data. And they want to understand data. And I'm constantly being barraged by journalists, economic journalists, other social indicator journalists, who want to understand what is the meaning of this and what's the meaning of that. And it's a very, very welcome trend. In this context, I want to say something about administratively produced data and survey-based data. Everyone knows the difference between administratively produced data and survey-based data. Anyone here who doesn't know the difference between the two? Okay. Administratively collected data basically means that it is being done by the administrative staff engaged in that line of work, in that line ministry. It's sort of regularly, supposedly collected and hopefully put online, or at least collected on computer and put online, and then it's made publicly accessible, as opposed to survey data. I want to give you an example of how much discrepancy there can be in our own wonderful country between administratively collected data and survey data. Routinely in the ICDS, you collect data about severe malnutrition, moderate malnutrition, and mild malnutrition. Don't have the time to go into the technical differences between the three of them, but let's just say that when the ICDS collects data about severe malnutrition, it tells you that under 1% of the children under 5 are severely malnourished. However, the National Family Health Survey, which is one of the most reliable sources of data that exists in our country, tells you that 16% of our children are severely malnourished. Now, who are you going to believe? Who are you going to believe? And of course, the ICDS data also tells you that a very high proportion of all the children who are malnourished are mildly malnourished. It makes sense for a government department to say that a very high proportion are only mildly malnourished, so we don't really need to worry about this. This is not a big deal. So you don't have to do too much about it. And so if the ICDS is failing and failing miserably and failing decade after decade, because it's a program started in 1975, that doesn't matter. Witness the lack of focus of any government, doesn't matter which government I'm talking about, on malnutrition. Isn't it? We have the worst malnutrition rate in the world. We're worse than Africa. We might be brilliant in sending, a spacecraft and satellites into the globe, circling the globe and the orbit, and we all feel very proud about this. But who's reminding us every day of what is the rate of child malnutrition in our country? There are another data that I have been looking for, because I'm sort of currently helping the UP State Health, UP government to initiate a state health policy, which is very good news that the new government is sort of starting a state health policy, want to devise a state health policy. But I want to know what proportion of health facilities are run 24/7. If a public health facility does not run 24/7, why would anyone go there? I can't decide when I'm going to fall ill. If I fall ill in the middle of the night, or even at 5 p.m. and the place is not functioning, would I ever think about going to a Sarkari dispensary? No, I wouldn't, because I know it's not 24/7. This country's demographic dividend, much which we talk about all the time, is going to run out in exactly 23 years' time. The young people in this room who are about 25 years old just now will be about 50 years old then. After 2040, there will be no demographic dividend. A demographic dividend is defined as a rising share of the population is in the workforce, meaning a growing share of the total population is in the age group of 15 and 64, and therefore is joining the labor force and is productive. In other words, the converse of that is that the share of dependent population under 15 and over 64 is falling, and the share of the working age population is rising. So in other words, they are available to generate wealth, savings, investment, growth, wealth. Now, clearly they can't generate wealth if they don't have jobs. So we need to know very regularly that jobs are growing. But we collect data only once in 5 years. Thankfully, the Ministry of System Plan Implementation is going to collect this data every year. But in the last 5 years, there has been an effort by the Ministry of Labour, the Labour Bureau, to actually collect data on an annual basis. Now, that's not the best quality data, but it has a sample size of over a lakh, of 1,25,000 in fact, which is comparable to the NSS. Not bad, but it's difficult to get access to that data because the story that it is telling post-2012 about jobs is not very good. So let me close by saying that when we think about data, let's not just think of it as dry facts, which should be used by researchers in analysis. It should be something that should be used for holding our governments accountable. Thank you very much indeed.